Hey guys, it's Dave. Today we're going to talk about a disease that's coming up in the spring, summer, and fall. That's the main time you see it, especially in the mid to northern United States. Some of the southern states you may see it year-round. But that's West Nile virus. And remember, as the name states, it is a virus, so there's no antibiotic treatment for it. It is the leading cause of mosquito-borne disease in the United States. Obviously, outside of the United States, you're looking at things like malaria, but in the United States, it is West Nile virus. Most people don't even realize that you have it. Most won't get sick, show any symptoms, anything like that. Maybe a little runny nose, maybe a mild headache, maybe a little bit of body ache, but most people will not even know that you have it. 20% or 1 in 5 will develop a fever. Fever can be treated with over-the-counter Tylenol or ibuprofen and be fine. However, about 1 in 150 people, it will develop into a serious disease, and it can be fatal if you don't get into a provider, get into the hospital for basically some restorative care, mainly looking at IV fluids to keep you hydrated and rest, as well as monitoring your pain with that. The main people that it really affects, it can really knock down, are the elderly and those that are immunocompromised. So looking at people like with organ transplants, with HIV, with tuberculosis, with a disease that's already got them knocked down. If you're a rheumatoid arthritis patient and you're on a biologic, it would definitely knock you down even more with that. Symptoms with it are headache, body ache, fever, joint pain, muscle pain, nausea and vomiting, diarrhea, and then one of the telltale things, especially when you get as an adult, when you get that fever and you get a rash, it's a severe rash, it's probably West Nile virus. Again, the best thing to do is just to stay at home, recover, make sure you're getting a lot of fluids. Again, something like liquid IV, things like that are good to get the electrolytes replaced, as well as water, especially if you're having vomiting and diarrhea with that. You really got to do that. Now, if you have a mild case, symptoms and recovery after that may last just a couple of weeks, where you're going to feel fatigued, run down, tired. If it is severe, and it's a serious case, it can affect the central nervous system and develop things like encephalitis and meningitis. Now, in that situation, especially if you're hospitalized, your recovery can take weeks, more into months with that. And with a more severe case, you'll be looking at the same symptoms as I stated before, but added into there, severe neck stiffness. You won't be able to turn your neck. It'll be very painful if you turn your neck. Tremors, stupor. You'll have trouble, maintaining where you're at. Your brain fog will kick in. Disorientation, convulsions, vision changes can also occur, as well as numbness in the extremities. So your fingers and toes may be numb. And like I said, with that, your recovery is going to take longer, and some of the effects can actually be permanent, especially if you do develop meningitis or encephalitis, where you may have trouble with your vision or with your fingers as far as numbness and tingling there. For definite diagnosis, they can go off of what your symptoms are, as well as how much West Nile is in the community, in the area. And they do that not only by the number of cases in humans, but the number of cases in pets. It can be transmitted into animals and from animals. Horses are especially susceptible to it. So if you have horses, you want to be aware of that. Or if you're around horses a lot, you want to be aware of that. But they also do mosquito screening, where they will go into where mosquitoes are, get a bunch of mosquitoes, get a bunch of the larvae, test them, and see if they have West Nile virus. So based on that and your symptoms, your provider may just say you have West Nile virus. We'll do this. Like I said, there's no real treatment for it. Mainly test or monitor for things as you progress. but you can do a test to definitely rule out whether you have it or not. It's kind of pricey. Be aware of that. Your insurance may or may not cover that. The good thing about West Nile virus is if you have it once, from what we've seen, immunity is a lifetime. So that's a blessing right there. There are exceptions. If you have a decreased immune response due to things like I said, HIV, tuberculosis, rheumatoid arthritis, anything that you may be on a biologic for, they have seen a second case occur with that. But for the majority of patients, if you get it once, you're good for life type deal. There is no vaccine for it. There have been vaccines in development, but nothing has come to market and testing is still out there. Mosquitoes actually, like I said, that is how you get it, is from a mosquito. Where they get it from is they feed off of dead birds. That's why it used to be where if you found a dead bird and it was spring, summer, or fall, you turn it into the Department of Health. They would run tests on it. They don't do that much anymore, but the mosquitoes get it off the dead bird. Then they spread it to humans and animals from there. Now, there is no evidence that you can get it from a dead bird. So if you went and picked up a robin and threw it in the trash, there's no evidence regarding that. However, use common sense. Wear a glove, wash your hands really well afterwards if you have to handle it at all, okay? Now, it can be passed from mom to baby. If the mom's pregnant, you still have the baby inside, it can be passed. It can also be passed on giving birth through the birth canal. And it can also, they found, be passed through breastfeeding. So mom, if you're not feeling well, you think you've been exposed, you've been around a lot of mosquitoes, that kind of thing, you may want to check with your pediatrician or your provider to see if they want to do a test on it so that the infant does not get sick as well, because the infant is going to be more at risk than you are as a mom. Rarely you can see it in blood transfusions. So if you are feeling sick again, and they will screen you at where you give blood, wait to give blood. Great idea to give blood, but not if you're feeling sick. As far as prevention, of course, number one, don't go out if there's a lot of mosquitoes if you don't have to. So late in the evening, at night, early in the morning, those are the predominant mosquito times. Of course, cover up. Hats, the long hats with the ears on them are great. Long sleeve shirt, long pants as well. You can spray, absolutely. If you're going into thick areas, you want to spray. I recommend vitamin B1 started a month prior to mosquito season, once a day, B1 100 milligrams, continued throughout the fall. That will help. It's not a guarantee, especially if you're in thick areas of mosquitoes, so you want to make sure you spray. If you're in your house, keep your doors and windows shut unless you have mosquito-proof screens. Again, there's no treatment for it. It is very easily recoverable if you don't have any extenuating circumstances. Most won't even know that it's there, but it's something you want to try and avoid.